Hello and welcome to vlog number 79. This week, at the request of YouTube user Clusterhead Survivor, I'm going to talk about medicinal herb, its positive and negative effects, and why I continue to use it despite having had deep brain stimulation surgery, or DBS. I have used this herb, I better not use the C word or the M word for fear of censorship, medicinally for several years now. After discovering that it alleviated my most troubling Parkinson's disease symptoms more effectively than the traditionally prescribed medications, without subjecting me to any of the unpleasant side effects of those meds. I've been asked to talk about the positives and negatives of using herb medicinally, so I'll start by detailing the positives. Firstly, it calms my tremor quickly and completely, without making me feel sick, and without causing dyskinesia, involuntary movement, which are two of the common side effects of the prescription meds. It helps to relieve dystonia in my feet. This is a state of abnormal muscle tone that results in muscular spasm in my toes, causing them to curl under my feet. It relieves the pain of muscular weakness and rigidity. It calms my anxiety and enables me to relax. It helps me get off to sleep and stay asleep. These are all positive effects that I experience. Different people may experience different or other beneficial effects, depending on various factors, not least of which is the chemical composition of the strain of herb being used. Another big positive is the fact that nobody dies from using it, and that's something that cannot be said for many or any of the pharmaceutical meds that are prescribed for the same conditions. Negative effects. I struggled to find anything negative to say about this medicine, but here goes. I get a mild high at the dosage that I take, which isn't unpleasant but which I regard as being undesirable. It can cause a dry mouth, but that's really not the end of the world. It may increase your appetite, although in some cases this is a positive effect. I notice a slight deterioration in balance occasionally, although it hasn't resulted in my falling. It causes my tinnitus to increase in volume, but to be honest, that's a small price to pay. In its herbal form, it can be quite pungent, which makes discretion difficult. It is currently illegal here in the UK, which makes criminals of sick people who are using it as a medicine. And make no bones about it, it is medicine. Because it is illegal, those using it medicinally have no choice but to grow their own, illegally, or purchase from drug dealers, a product that is variable in quality and content and which may contain dangerous residues from chemicals used to boost yields or control pests. Lastly, the use of this herb carries a social stigma, and you are unjustly labelled as a druggie or junkie, which simply doesn't happen with pharmaceutical meds which are prescribed by a physician. I used to use it 4 or 5 times a day prior to my DBS operation. Since DBS, I only use it once, sometimes twice a day, usually in the evening, to help me to relax and get off to sleep. I've been asked a number of times why I still use the herb now that I have had DBS. DBS is very effective at controlling tremor, which is my main Parkinson symptom. But you have to remember that the symptoms of PD are variable and can change from day to day, from hour to hour, from minute to minute sometimes. On occasion, my tremor can break through, becoming too strong to be contained by DBS. Most people who have DBS are able to reduce their prescription meds. Few are able to completely eliminate them. I feel certain that if it were prescription meds for PD that I was taking, there wouldn't be any comment. It's purely because I'm using a herb to help control any symptoms which DBS fails to control that people remark upon it. Understand this. This herb is my medicine, and I have a need to use it for my symptoms, just as many others have a need to use the prescribed meds. My use of the herb deserves no more scrutiny than would the use of prescribed meds. The prescribed meds, of which I have tried a variety, are not so effective for me and make me feel very ill, and that is why I decline to use them. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week. See you next Friday.